The healthcare system over the years I've been in medicine has gotten far, far more complex. There's pre-authorizations, there's tiers, there's exclusions, there's all sorts of different things, and it becomes very, very difficult for the patient to navigate those systems.
I needed to get an MRI. Northwestern had already just made an appointment for me, and my out-of-pocket is $2,500 a year. The MRI would have cost me $2,468.
When the doctor tells the patient, I need you to go get an MRI, the immediate question is frequently, okay, great, what is that going to cost me? And the doctor has no idea. So Markit Medical gives them the ability to say, I don't know, but Markit Medical is going to look up a range of options and they're going to send them to you so you can see where you could go and what it'll cost. It gives them a really nice, easy way to answer that question.
Using Markit Medical, I got two providers closer than the nearest one at Northwestern. One $570, the other $600. Those who know me know I'm cheap, so I went for the $570 one.
As long as they're getting the test done, that's our main concern. We want to make sure we're still giving our patients the best health care while we understand the cost is a major issue for them.
Most patients don't know. There's a lot of work that your doctor's office and their staff are doing to help you get the test approved and get scheduled and get to the next phase, and paperwork that they have to forward on. And so we do a lot of that for the physicians that we work with so that the whole process is easier.
Markit Medical is able to get authorizations done much quicker. The amount of time it took us to get it approved, Markit Medical cut that dramatically. Even if we got, let's just say, a CAT scan pre-authorized, getting the patient there and getting it done and increasing their compliance was always an issue. So what Markit Medical does now for our patients is they make the appointment. And that increases the compliance dramatically.
So when we hop on the phone or we send them an email and they see their options, they're shocked. And one particular story I remember is I was actually guiding the patient through all of her benefits. I explained to her exactly what a deductible means, what a co-insurance means. And it's not until that she realized, oh wow, I can make a cost-effective decision. And the best part is my doctor will be happy with the place I choose because it's one of their preferred facilities. And she ended up asking me, how can I have you work with some of my other doctors and other services that I'll need in the future? And that to me felt like I really made a difference to her.
Anything you buy, you go on the internet, right? And you price shop across the services you want. Medical's probably the last place you can do that. And I think for a lot of us who don't really understand what a lot of these tests are or really do, are even more reticent to look and price shop. And I think when you start looking into some of these things, you realize that there's a lot cheaper ways without really changing the quality of service.